Hello, we are excited to be back this week, which is surely one of our more fun topics, and that is talking about things you can do to get pregnant fast. Last week we talked about how to not get pregnant. This week we're going to talk about how to get pregnant fast.
Yeah, we're going to be covering the evidence-based practices about getting pregnant naturally as quickly as possible, including that number one thing all couples can do to help get pregnant faster.
Yes, if this is your first time meeting us, my name is Sarah. I am a board-certified OBGYN and fertility specialist.
Yep, I'm Kurt. I'm a board-certified pediatrician.
And we are the Doctors Bjorkman.
Welcome back. As we mentioned, this episode is all about getting pregnant and improving your natural fertility.
Yeah.
You may remember this was actually one of the very first topics we ever covered,
Yeah.
but since there's been an updated guideline released by the American Society of Reproductive Medicine, we thought we'd go back to cover all those key things to make sure that you can be working on to help get pregnant more quickly.
However, we do want to say that infertility is incredibly common. This occurs in 1 in 6 to 1 in 8 women or couples. And this is something I deal with every day as a board-certified infertility specialist. And infertility is becoming even more common as our population changes.
Yeah, and one of those reasons actually affected us. As you may already know, we went through the IVF process for baby number 2 and shared everything we went through on a prior series. As we suffered from secondary infertility. I actually had significantly reduced sperm counts back in 21, 22 after having COVID.
Yeah. So before we talk about those tips to get pregnant fast, let's talk about how easy or difficult it is to get pregnant on a month-by-month basis.
Yeah. Now, when it comes to getting pregnant, I think I remember you saying something that age has a whole lot to do with it.
It does. So for women less than 32 years old, each month when you are having regular unprotected sex, you have about a 20 to 25% chance of getting pregnant each month. At age 35, however, that number is about half of what it was, so about 12% at age 35 in women who have never been pregnant before. It's slightly higher for 35-year-old women who have had a baby before at about a 15% chance per month, but we are not super effective at reproduction as a species. And by the time a woman is 38 years old with no prior pregnancies, your chance of pregnancy is as low as 5% per month.
Yeah. Now, for couples, 80% or 4 out of 5 will conceive in the first 6 months of trying, with the highest likelihood in the first 3 months.
Yes, egg and sperm usually do get it together, but it's really important to remember that infertility is a disease. So if you have been trying for more than 12 months with regular unprotected exposure to sperm, you should go be evaluated for infertility. You should be evaluated for infertility even sooner if you are older than 35, if you do not have regular periods, or you have other risk factors for infertility or GYN history.
Yep. Now, remember that there are also many reasons for male factor infertility.
Yes.
These things include things like recent infection, but also greater age in the males, greater than 40, 45 years of age, smoking, prior injury, and anabolic steroid use can all be associated with reasons a couple may be having trouble getting pregnant. Yeah. With that, let's talk about the keys to optimizing natural fertility, and our mnemonic for this is FAST.
Yes, so the first thing to think about is fitness. One of the best things you can do for yourself, your fertility, and the health of your pregnancy is to be healthy. Particularly in this case, I am talking about regular aerobic activity and being at a healthy weight. So weight and BMI in many ways are only numbers and not a perfect predictor of health. But we do know that both being significantly overweight or underweight do affect your chances of conception.
Yes. Now, having a BMI greater than 35 on average doubles a woman's time to conception. And this can be even significantly longer for those with higher BMIs.
Yep.
Also, having a low BMI or a BMI less than 19 on average increases the time to conception for a woman by 4 times as much.
There is a lot of conversation, and you will see many ads on the internet about special diets and supplements as well. But there is no strong evidence to suggest that there's any magical supplement that you take or any, special dietary variation to increase your chances of getting pregnant.
Yeah. Now, having said that, diets lower in red meats, sugar, and other processed foods, and higher in things like seafood, poultry, whole grain, fruits, and vegetables are related to better fertility in women and better semen quality in men.
Yep.
These variations may likely be driven, however, just by overall health and fitness.
Yes. The one supplement that I do recommend all patients be taking prior to trying to conceive is a prenatal vitamin with folic acid. The key here is to have that prenatal vitamin that has at least 400 micrograms of folic acid every day. This has been shown to significantly and clinically reduce the rates of neural tube defects in infants. There is some recent controversy about different types of folate, methylfolate versus folic acid, and if your prenatal vitamin has methylfolate in it, many of these newer fancy prenatals have methylfolate. I always recommend that my patients also add 400 micrograms of folic acid because that is what has been studied, that has been shown to prevent neural tube defects. So always also be taking some folic acid.
The next thing to remember when trying to get pregnant is to avoid things that decrease fertility.
Yeah. The biggest offenders of decreased fertility in women are tobacco, alcohol, and caffeine, and other toxins or drugs. Smoking is particularly an issue as it not only decreases your fertility, but also increases the likelihood of miscarriage and preterm birth.
Yeah. Now, cigarette smoking is also an issue for male fertility as it is associated with both decreased sperm count and decreased sperm mobility or their ability to swim.
Yeah, alcohol consumption can also decrease natural fertility. Now, having one drink is more than likely totally okay when you are trying to conceive. But women who have more than 2 drinks a day are more likely to have infertility. And of course, there is no known safe amount of alcohol once you are pregnant, and it can negatively affect your baby's brain development.
Now, caffeine is also something to think about. High levels of caffeine, or in particular more than 5 cups a day, has been associated with decreased fertility.
Yep.
And during pregnancy, 2 to 3 cups a day may potentially increase the risk of miscarriage. However, having said that, less than 2 cups a day has been shown to have no effect on fertility or pregnancy outcomes.
Correct. So we say kind of shoot for 200 milligrams of caffeine or less per day. We also talked recently about the evidence of marijuana use in pregnancy, and its use has also been associated with infertility, and it seems best to avoid when trying to conceive. Notably, women who reported smoking cannabis are 1.7 times as likely to have infertility as those who do not.
Yeah. And men who smoke cannabis have almost 30% lower sperm counts as compared to men who don't. And this effect appears to be dose dependent.
Yep.
However, there is most certainly this confounding effect that men and women who smoke weed are more likely to smoke cigarettes as well, which we know has a strong association with infertility. So the true role of marijuana here is unclear. Now, there's some data from the National Survey for Family Growth and North American Preconception Study demonstrated no association between cannabis use and time to pregnancy.
Other things to think about are toxins like dry cleaning solvents, pesticides, heavy metals, which can be detrimental to both female and male fertility factors. All right, the third thing to think about in terms of getting pregnant fast is the S, or sex. Patients ask me all the time, do sex positions matter? Do I need to stay laying down? Should I put my legs up? What does the data tell us?
Yes, so when it comes to sex positions in particular, there's no clear benefit from one position over the other.
Correct.
There's no benefit from being supine or laying down with your legs in the air after the fact. And this is really just because sperm is quite quick. It gets to the fallopian tubes within 15 minutes, or maybe sometimes as quickly as 2 minutes.
Yes, so what about orgasm? Do you have to have an orgasm to increase your pregnancy rates? And the answers there are no, of course. Highly recommend.
Highly recommend, yes. What about frequency? So in terms of sperm quality, sperm health, there is some data to suggest that long times between ejaculation can be associated with decreased sperm quality. This is like greater than 5 days, and particularly greater than 10 days between ejaculation has been shown to decrease the quality of that sperm. The other important thing to say here is that daily ejaculation does not seem to decrease sperm count, and those with low sperm count or oligospermia may actually benefit from daily ejaculation.
Yep. Another important thing to think about here is lubricants. So we know that certain lubricants can decrease sperm motility. So things like KY, Astroglide, olive oil, and even saliva can inhibit sperm motility. And so the things we recommend are some fertility friendly options. These are hydroxyethyl cellulose based, Pre-Seed, Conceivies. I think Frida Mom has some fertility friendly lube. You can also head to the kitchen. You can use mineral oil or canola oil, as these things do not inhibit sperm motility.
And finally, the fourth thing here is T for timing, which is the most important thing to think about when trying to get pregnant fast.
Yes. So kind of the important thing to think about here with timing is your fertile window. When is it actually possible to get pregnant each month? And so there's kind of a 6-day window. So when you ovulate, when that egg is released, it can live for about 24 hours. And so sperm, interestingly, can live somewhere between 2 and 5 days in the reproductive tract. So we really say your fertile window is that day of ovulation and the 5 days before. We do know that intercourse is most likely to result in a pregnancy when it occurs within that 3-day interval that ends on the day of ovulation.
Yep. And this has to do with how long sperm lives, because sperm can live anywhere from 2 to 5 days, and you want to make sure that it's there around to meet the egg when it's released.
Correct.
There's some really nice data from that ASRM guideline that was just published in 2022, looking at kind of if people had intercourse 1 day a month during their cycle, when were they most likely to conceive?
Yes.
And here you can see kind of how it peaks right before that 2-second week of the period, kind of this 12 to 14-day measure. And then also looking specifically at a graph of like days prior to ovulation, and again showing that the days that are like most important to target are those 3 days just before ovulation.
Yes. So you can see that kind of figuring out when you are ovulating can be helpful to help figure out that timing.
Absolutely.
There are different ways to kind of track ovulation. One of them, so there are physical signs. Your cervical mucus changes around the time of ovulation. Increasing estrogen levels kind of cause this, what we call egg white cervical mucus that's very stretchy. And that is something we see, hey, around the time you're going to ovulate, that cervical mucus change. There's changes in basal body temperature. Your basal body temperature rises after ovulation. That one is more of a look back that says, yes, I did ovulate. It doesn't help as much pinpoint when you're going to ovulate. And then there is something called ovulation predictor kits, or OPKs. And these are strips that you pee on that help detect an LH surge. The LH surge kind of happens 12 to 24 hours before you are going to ovulate. So I always recommend patients pee on these strips or dip them in a little cup of urine, usually starting around day 10 to 11 if you have 28-day cycles. And you do those sometime between 10 a.m. and 2 p.m. starting day 10, 11 of your cycle. And that is because that LH surge happens in the morning. So it has to get from your brain to your bloodstream to your urine. And so first morning urine actually is not the best time to do those OPKs, because that kind of reflects what happened yesterday. So those are things you can do to try to help see when ovulation is happening. Having sex kind of every other day after your period is also a very effective.
Because otherwise it gets kind of challenging to just track everything. So if all of that tracking is a little bit complex, it definitely helps if you don't have access to your partner all the time. But if you have if you guys see each other throughout the month, it is nice to say kind of around that cycle day 10, intercourse every 1 to 2 days as works best for you, will mean that you're right there in that fertile window.
Hitting your fertile window, yep.
So this whole trying to get pregnant intentionally piece can really be one of both the most fun parts of having children, but also sometimes it can get a little old if you're not having success.
Yeah, he's like, romance me a little bit.
Yeah.
And I hear this from patients all the time. You know, your mother-in-law, when are you guys going to have a baby? What's going on? Just relax. All these things. And, you know, reproduction is not small talk, and people kind of forget that. And so, you know,
it's really easy to have if you are having you're really working on having a baby month after month without success. There's this weird pressure that happens sometimes, both for I imagine for hopeful future mom to be and for dad to be too. And so I think if you can find ways to remove the stress out of it, and like, see that for what it is.
And to remember that fertility is kind of the first time in your life where effort does not always equal reward. You can
There's some rewards.
you can do all of the things right.
Yeah.
You can be ovulating, you can have sex at the right time, and all the stars align, and then you're not pregnant, and it can get hard and disappointing. And great, yes, most couples do get pregnant in the first 6 months. When you look at the data, usually about 60% of couples get pregnant in the first 3 months.
And then 80 by 6 months.
Yes, and 85% by 1 year. So hang in there. You're doing the best you can. It'll happen. If it doesn't happen, go see your OBGYN, get a referral to a fertility specialist, your local REI, because,
Sometimes there's things that need help, and sometimes it's dad's fault, right? And so, like, think about other things, like, there's all sorts of reasons, and so, like, don't just assume it's the woman's fault. It's, like, often
50% of the time there is a male factor when it comes to
two to tango and two to make this happen. So like if you're not having success, like, go get help. You would be surprised the things you might find about yourself and reasons you're struggling.
Yeah, but do have some fun. It's having done both IVF and a natural pregnancy, getting pregnant the old-fashioned way is much more fun. But hang in there. Good luck sending all the baby dust.
So let's just summarize all of these things one more time. How to get pregnant fast.
So the F is fitness. You want to be healthy and well. Have a good diet. Sleep 6 to 8 hours a night. Drink lots of water. Be on a prenatal vitamin. Repeat this for your life. Be at a healthy weight. That is the F for fitness.
Yep. A is things to avoid, making sure to avoid things like tobacco, excessive use of alcohol, and other toxins.
Too much caffeine.
And too much caffeine.
No marijuana. Yes. The S, sex. Have it. Positions do not matter. Staying with your legs in the air doesn't matter. Laying in bed for half an hour with your hips up has not been shown to improve pregnancy rates.
Yes, but there is the T, which is timing. T is the timing of the month when you're having sex. Ideally looking for that fertile window, the 6 days before ovulation, and having sex every 1 to 2 days in that window as you are able.
Yes. So, good luck. Happy baby making. If you have any questions, comments, please leave all PG related thoughts in the comments below.
Yeah, and make sure you're subscribed for weekly videos going through pregnancy and all sorts of other topics about pregnancy, parenting, and childcare.
See you next week.
Bye, guys. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.